I'm Dr. David Collins. I'm an emergency medicine physician here at OHS, here to talk about COVID and what it means. Well, the first and foremost is stay home. When you test positive, we've talked at length, and CDC is constantly making changes and updates, but for the time being, it's 14 days at home, monitoring your symptoms. But then the question always becomes, well, what are the symptoms I need to watch for the most? And in the context of COVID, it's a coronavirus. It's one of the cold and flu bugs that we see, and COVID is just a little bit different and a little bit more dangerous that we've come to learn over the last couple months. And as an emergency physician, the big red flags that we talk about is oxygen requirements and feeling short of breath, ultimately. So the question that you should always ask yourself is, am I feeling short of breath? And for some folks, you don't notice it right away, and it might be your family members just knowing that you're pausing a lot to talk, or you just are getting more winded. And that's definitely one of the more concerning factors, because ultimately COVID, the most dangerous component that we've come across so far, is the risk of getting really bad pneumonias or really bad lung damage just from the virus itself. COVID shouldn't really impact your daily life by any means, so please don't feel like you need to be eating certain things or drinking certain things. Obviously, as a physician, we recommend lots of hydration, drinking lots of water. That's kind of a given whenever we send someone home when they've got the flu or a GI bug or what have you. But, the bigger thing is just trying to, eat what you can tolerate. Obviously, there's no hard and fast rule by any means. The one thing that people have commented on that I know both here and reading other stuff is that people that lose their sense of taste or smell tend to eat a lot more because they just are trying to find something they like. And, that's, go for it. You can try to find something, but some people, they lose taste completely no matter what they try. You can certainly try. Some people have found that they just get more short of breath doing basic tasks like sweeping the floor, yard work, etc. And if that's the case, I'd advise against anything incredibly strenuous by any means. But you can obviously try alternatives. Going on walks and stuff is still okay as long as you're alone and you've got a mask on, just to prevent anyone else from getting what you have. For those of us that have symptoms still and we test negative, the advice is still to hold out for those 10 days and until your symptoms improve. You don't have a fever for 24 hours without the help of Tylenol. Tests aren't perfect. They're man-made, obviously. I think that our rapid test has gotten better in the last 6-7 months that we've been trying to figure out tests for COVID, but no test is certain. And if we're really concerned as physicians, we'll probably do the send out just because there's a little bit more reliability on that. If it's positive, it truly is positive versus what's a false negative. For folks that, we send home from respiratory clinic and tell them to stay home, socially isolate, drink lots of water, there's really not a quick fix necessarily. It's very much like any time that you get the common cold. If you're getting a lot of congestion, if your ears feel full, we might recommend doing over-the-counter decongestants. Ibuprofen and Tylenol are great for pain control and for fever control. All of this is more so just to help you be more comfortable during this time, because COVID can really make some people feel very run down, and some people COVID doesn't really affect you at all. I know that there's also questions about, what about the medications that we see in the news and the advertisements and all that stuff. And for the time being, from my training as an emergency physician, the data that we've looked at, we've done research since COVID has started, and the only things that we've seen so far that have some promise is dexamethasone. It's a steroid. But again, this is something that we would only advise in the cases of people that need tubes down their throat, that are doing very, very poorly respiratory-wise, and that theoretically can help reduce the severity of their inflammation and their lung disease. The other one that gets out in the news now is one called remdesivir. Again, it's another very special medication, but again, only in the context of ICU setting where people are doing very, very poorly. So in the context of day-to-day, it's great news that you don't need those medications, because they have their own set of risks and complications. So knowing that for a majority of the people that get this illness, they can do pretty well with just the over-the-counter medications.